Hello, I'm Matthew Kaufenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to talk about falls and preventing falls. Now the importance of this discussion revolves around some very simple statistics. 1 out of every 3 adults over the age of 65 will fall, and the likelihood of breaking your hip at that point does increase. Now if you do fall and break your hip, half of those individuals who fall and break their hip will not return to their normal level of function. And then if we take that a step further, if you are 75 years of age and you fall and you break your hip, you're going to likely spend at least 1 year in a long-term care facility. And then finally, probably the most alarming statistic is that falls are the #1 cause of accidental death in individuals over 65 years of age. So it's really important that we talk about falls and that we talk about how we can potentially prevent falls. So what causes falls? There are a multitude of reasons for individuals falling. Some of them are medical conditions, some of them are medications. The one that we're going to talk about today is related to muscle strength and balance. Those two really go hand in hand. If you are weak, you're going to have poor balance. So what's really nice about this discussion is that I can show you at home a very simple tool that you can do to screen yourself for risk of falls. So we're going to talk about that tool, and then we're going to talk about 2 simple exercises that you can do at home to reduce your risk of falling. So the tool we're going to talk about, the screen that we're going to talk about to assess your risk of falling, is a 2-part screen. The first part is simply answering 3 yes or no questions. The first question is, have you fallen in the last year? Yes or no. The second question is, are you afraid that you might fall? And then the final question is, do you use your arms to stand always? Do you always use your arms to push yourself up and stand? If you answered yes to any of those questions, you are at a high risk of falling. If you answered no to all of those questions, then you can move on to the second part of the screen. The second part of the screen is a simple sit-to-stand test that you can do right in the comfort of your home. You need to have a firm chair to be able to perform this on, feet flat on the ground. And really, when you do this test, you want to do it with your arms crossed. The test is designed to determine if you can stand up without the use of your arms. It's also a timed test. So you have to have a stopwatch near you, or you have to have a clock with a second hand, but it's a 30-second test. So what you do is you stand up and you sit down, and you stand up and you sit down with your arms folded, and you do as many as you can. You count how many you can do in 30 seconds. So the test looks like this. Just cross your arms in front of you, and you stand completely up, and then you sit all the way down. You can't do it like this. That does not count. You must come all the way up and then come all the way down. And again, you time yourself for 30 seconds and you count how many you can do in 30 seconds. Now, if you complete 8 or less of those in 30 seconds, you are considered at a high risk of falling. If you complete 9 to 12, you're considered a moderate risk for falling. If you complete 13 or more, you're at a low risk for falling. So what do we do about this? If you're in the moderate or high risk category, you do want to start some exercises at home. The first exercise is simply the sit-to-stand exercise. You just work on sit-to-stand. I recommend that you work yourself up to being able to do 2 sets of 20. The second exercise that we are going to do, it's also a standing exercise. What you want to do is you want to stand, and ideally I would stand at a counter or I would stand behind a chair so you have something to hold on to. But you stand on one leg, that leg should be slightly bent, and then you kick your leg out 20 times. And again, you want to do 2 sets of 20. I would recommend that you do these every other day. If you're at a high risk of falling, or if you are fearful of falling, please contact your doctor. Please contact your physical therapist. A physical therapist could easily start a program for you to reduce your risk of falling. Thank you very much. If you have any questions, please call me at 218-346-2464.
Thank you for watching Wellness for Life.